Well, just a few weeks until they expire, Congress is still deadlocked on a plan to extend Affordable Care Act subsidies. Today, the Senate is expected to vote on two competing health care plans, but neither is likely to pass. Roughly 22 million Americans rely on the subsidies to help lower health insurance premiums.
Here to talk about two plans and the impact this could have on American families is Politico reporter Robert King. Thank you for being with us this morning. We appreciate it.
Thanks for having me.
So Democrats, we've been talking about this morning. They want to extend the subsidies for 3 years. Can you talk a little bit about why Republicans are against this right now?
Well, Republicans have been not the biggest fans of Obamacare, even ever since it was passed in 2010.
I think that's an understatement.
They've really zeroed in, though. They believe that the subsidies have led to an explosion of $0 premium plans, and that this has led to phantom enrollees, people that don't use any health insurance and that were signed up on the exchanges without their knowledge. And there have been instances of this on the federally run exchanges, not so much in the state-run exchanges, but that's one of the driving factors. They are also concerned about, they believe that the subsidies give a bailout to insurers. They don't like that. They want, President Trump himself has said he wants to give the money directly to Americans instead of sending it to an insurance company, which will give it to the consumers in the form of lower premiums.
Yeah, and talking a little bit about the Republicans' plan, countering with their own plan, instead it would rely on health savings accounts. Explain what this means for people.
Sure. So a health savings account is available right now for a bronze level plan. And we get them in commercial plans. They're a pretty popular feature. They're essentially, you can take pre-tax money from your paycheck and put it into an account, and you can use it for a variety of services or costs. You can use it to pay down your deductible or your copay. And so the proposal from Senator Bill Cassidy and Mike Crapo is to give certain individuals a government-funded health savings account. It could be between $1,000 and $1,500, depending on your income. And they believe that this will be a better option that will give Americans more choice and more control over their healthcare costs. But an important caveat is that an HSA cannot be used to pay down premiums. So they will still feel the brunt of the premium hikes that are going to be occurring right now due to the loss of the enhanced subsidies.
You know, there's obviously this played into the government shutdown that we just saw for so many weeks, so many people not getting paid during that period of time. That's now rectified itself, but this has been an ongoing battle. One of your colleagues at Politico just a few hours ago put out an article saying health insurers asked the GOP to fix their fraud problem and extend Obamacare subsidies. What is this kind of last-minute attempt?
Sure. So health insurers have been pushing Congress for a long time to extend the subsidies for well over a year. Everyone knew that this cliff, which was created in the 2022 Inflation Reduction Act, was coming. And insurers have been worried that they are feeling the brunt of the Republican opposition to this. Republicans say that insurers are scamming Americans and taking the money and everything, that it's a bailout for insurers. So they're trying to thread the needle on this. They're trying to say that we are willing to work with you on fraud. We're willing to work with you on reforms, but losing these enhanced subsidies is going to harm your constituents and is going to lead to less access to care.
Yeah, I mean, this is 22 million Americans that rely on these subsidies. So we all know what could happen there. There could be no insurance for a lot of people. All right, well, thank you so much for joining us. Definitely some insightful stories that we'll have to continue to follow.